everyone, and welcome back to You Can't Deny AI. Today we have the privilege of talking to Dr. Tadepalli.
Thanks for having me. Excited to be here. My name is Tadepalli. I'm the physician director for perioperative services and the assistant chief of anesthesiology and perioperative medicine at Kaiser Riverside, covering the Riverside service area from Corona, California to Palm Springs, down to Temecula. In those roles, I oversee the programs that we focus on for clinical quality, data analysis, and patient safety, and work kind of behind the scenes to create a lot of digital infrastructure to analyze our data and create workflows and processes behind it.
That's great. So, what was your first experience with AI in healthcare? And was there a specific moment when you realized how much potential it really has?
It's been an evolving exposure to AI. I think, you can kind of separate it out into like the clinical impact and then the operations, kind of how do you make like a hospital work behind the scenes. I think, especially with, we currently use a bridge. So a bridge is a ambient AI listening, synthesis, and, writing tool. But, what has really struck me as important is while you may think that using these things improve your productivity and allows you to be more efficient, it certainly does, but the bigger impact is that the burden of providing the care decreases a lot for the person using it. So you hear things like, wow, my job feels so much easier, or wow, I was so tired and burnt out from all my work. Now I'm actually feeling like I can do my job. So that for me, as someone who cares deeply about, the future of medicine and its impact on our lives, I'm encouraged by that. Um, from a clinical operations side, I think what I see is that as we continue to build out like data sets and infrastructure, so meaning that as we get more information, we're able to get more understanding of how systems work. Not necessarily just looking at things from like what's happening right now, but what's happened over the last 3 months or 1 year. But as you can imagine, when you're in a large health system, you're now creating and housing millions of data points every day. And so combing through that or figuring out, hey, what are the things that I should be looking at in these large data sets is really going to help us moving forward in terms of, the practice of medicine and healthcare in general. And so for us here in Kaiser, we're creating, our workflows around clear ways to create data in preparation for leveraging AI. Though, right now there's still a number of like privacy concerns that occur around PHI and what we can provide into closed AI models within for-profit companies.
So how would you say you use or interact with AI in your day-to-day work now?
Yeah, I mean, for AI clinically, a lot of it is either clinical triage or clinical summary. So, clinical triage is you have a complex patient in a unique scenario, and to better understand impacts of certain aspects of their care. So, if you're having a big surgery and you are coming in an urgent scenario with severe medical problems, a quick way to kind of go through those issues and consider them and then use it to help you manage a plan in a very short amount of time is one example of how we're using it. The other is really just for this assistant with documentation. When you think about like the documentation burden and what we're leveraging it for, whether it's the ambient listening and synthesis for complex patients. So making sure that we can create clear instructions and clear documentation in the chart. Um, yeah, within anesthesiology, we created a perioperative medication agent. So, you can kind of open query it and it can give you relevant information, custom instructions, translation. And so there's a lot of different ways that we're seeing how it can have impact. The challenge, though, is that the number of licenses, and the rate in which AI is improving is actually improving much faster than we can actually learn how to use it. And so, from a doctor or nurse's perspective, we're busy doing clinical work a lot of the time. So it's like, how do you get the extra time to kind of learn how to use it? And then the disconnect sometimes is the people who are responsible to use it, whether they're like data analysts, computer programmers, whatnot. A lot of times they're not as privy to how that data is being captured, or what the workflow is, or what's going on the clinical side that's driving all that information. And that's really where, having clinical people managing data really helps in terms of the architecture. And I don't know if you guys are probably learning more about AI as this goes along, but AI is actually quite dumb. It's only as smart as you are with it, in terms of creating context and giving details and providing documentation, and then following up and taking that time to really manicure your output.
Yeah. AI definitely has a huge impact on both the physician and patient side. Focusing more on the patient side, do you think that AI has an impact on patient experience? For example, if they have preconceived notions about their care, how their care should be going forward?
Yeah, though I guess I would say in the age of AI, it's no longer a preconceived notion, and it's much more likely to be like deeply evidence-based consideration. What we find on the patient side now is that even a very specialized um, clinician, like, a subspecialist surgeon, or even, if you're like an extremely specialized, like eye doctor for kids, let's say. Now you actually may have a patient coming in who's asking very relevant questions to their care that you may not be prepared for, actually. Like, wow, you're asking the incidence of like a rare disorder that I'm treating, and I may not have been asked this before. So I think more than ever, patients are empowered. But again, you have to be careful trusting AI exclusively, because it tends to be very, it supports the ideas that you put out. It doesn't give a lot of pushback. And so you have to be careful with that, especially in medical care, because, it's easy to think it's one thing, and you go down a path that then you either lose time or you can't go back with. The other, I think, is that patients want access. The challenge, like getting into your doctor, or following up on a test, or getting that test done. And so, there is like a very significant opportunity here to not only make it easier for patients to have access, whether that's, you already see these like automated like AI agents when you call, right? The other is just in terms of interacting with the clinician himself. In the last since COVID, actually, the number of messages that patients send is dramatically increased, and so the workload related to that um, has definitely been a big impact on the clinicians who have to manage those messages. But now with AI, whether it's AI agents or bots that reflect the thinking and the speech patterns of that physician, being able to respond to messages in a much quicker period, that will certainly improve the patient's access. Last year at the American College of Surgeons Quality and Safety Conference, there was a pediatric surgeon from Australia who presented an actually AI video avatar that does all of his follow-up appointments. And so it speaks and looks and talks like him and has the same knowledge base as him. And but it's able to independently interact with the patients. And actually, the patients love it, because they know the person, but they have immediate access, and that access is giving accurate information. So, there are definitely a lot of opportunities from the patient's perspective on how AI can improve their experience. I guess the last thing I would say to that is just transparency. I think a lot of times patients and clinicians may have differing opinions on what actually happened in a visit. And so I think by allowing clinicians to just focus on the visit itself, like with the patient, and then have an easy way to have more accurate documentation, it actually improves that physician patient relationship or that clinician patient relationship. But it takes time to adopt and get people to use it. And there's always suspicions on multiple sides on, AI and listening and these things. But definitely there's a lot of opportunity.
It makes sense that patient relationships play such a huge role. Moving from patient experience to clinical application, which specific areas of medicine do you expect will see the biggest shift towards AI in the future?
The Well, here, I think everything is going to make a shift towards AI. Every single specialty is going to develop nuance uses for AI within the specialty. And the specialties that are going to have control over it are the ones that are going to figure out how to use it internally first. Um, you know, with regards to the larger question, I think just specialties that create a lot of data are going to be more impacted by AI. So, I think you hear a lot about like clinical images, whether it's like radiology, pathology, and anesthesiology. Now they're, creating intelligent, like centralized data analysis of all of the vital signs coming in from all of the hospital locations, and then identifying preemptively where, patients are developing patterns where you need to intervene early. And then I think just in general, the things that affect us all are, patients getting access to care, documentation and accuracy, summarization and access to real-time evidence for discussion. So, open evidence or Doximity GPT, these two AI agents for clinicians, they really, before imagine, like, let's say you're developing a workflow in the hospital and you get a bunch of people together and they would leverage their expertise and previous experiences to develop new workflows and occasionally use meaningful data that's relevant, right? And now that same conversation, without much time has passed, has become immediate evidence-based evaluation of ideas with real-time data that's aggregated and synthesized with better understanding for a better discussion and creation of workflows. So, in a very short amount of time, it's having a large impact. And what I just described will impact every single specialty. There is some fear mongering about, radiology and these things, and it's hard to tell, right? Like, because yeah, it is going to be able to analyze and analyze information and provide recommendations. But in the litigious environment which we're in, where patients and people want someone to be responsible, that's definitely an important consideration. The other is that as these patients are kind of leveraging these tools, and clinicians are leveraging these tools, it's unclear where it's going to take a lot of specialties, right? I mean, if AI is really all it's cracked up to be, we might be doing things completely differently, new medicines, new types of procedures, or improving productivity so much so that we're able to generate more access or take better care of the patients. So, I would be cautious. Like radiology is a good example. Despite AI being in the field for a very long amount of time, right? No one has replaced, a large group of radiologists um, with it yet. Now, could it impact like the future of like the training and how many people will go into it, and will that impact the need for AI? Possibly, but all that's happened in the last 5 years as AI has gotten more involved is that the number of studies has gone up dramatically. So people are requesting more studies, and we're needing to read more studies. And one thing about healthcare, people always talk about the weights and how things are, and despite all attempts to be efficient and productive, there's still a lot of challenges. And so, instead of getting replaced in healthcare, I've always kind of viewed we have so much work to do that we actually need increases in productivity just to get back to baseline. When like units are understaffed and there isn't kind of enough time to put together an information to make decisions. my viewpoint is we actually need AI to help us accomplish the work we're already tasked to do, because hospital and healthcare systems are overwhelmed.
Yeah. And looking ahead at maybe the challenges that physicians face in their day-to-day life, what improvements or advancements would you like to see in AI that could possibly help with those challenges that the physicians face in healthcare?
Yeah, I kind of touched on it before, but I think things that directly impact the care experience. So, care experience is both ways. It's the patient experience as well as the clinician experience. And so, things that improve the care experience will improve that relationship. And by those two, kind of, the patient and the clinician having better care experience, then things will, in my opinion, de facto improve. Productivity improves, efficiency improves. People are willing to give a little bit more effort when the job feels a little easier and they feel supported. So I think, those things like a bridge are helping a lot. I think in the future, having a more forward patient-facing interactions that can be generated by AI, or done by AI, will help, because I think it'll take a huge burden off the clinicians who are having to respond to all these messages and digital interactions, but it'll provide an immensely satisfying experience for the patients. In a large organization like ours, there's a lot of impact. So for us, the rollout has been actually a little slower than what you would imagine, compared to like, Mayo Clinic or some of these other big players who are, developing very comprehensive agreements with like Google and whatnot. But our kind of mantra has been, protect the patient, protect, our data and information, to make sure that it's not getting lost into AI models. And I think that that's definitely something important to think about. Closed AI models that functions within for-profit companies, which is fine, and there's immense innovation. At the same time, when you're thinking about the data that you input is used for AI training, the question is like, do you want like a patient's full information to like be in an A, like, do you want that AI to essentially know everything about that person, And I think that there's a lot of hesitation around that, especially in terms of like generative AI within, the medical record in and of itself. So there's still like a lot of kind of governance and whether that's with the law or even just internally, that needs to happen before we can really see the true benefit of AI. But we're definitely headed in the right direction.
Great. Thank you so much for your time today, Dr. Tadepalli. It was great hearing from you.
We really appreciate you taking the time to share your expertise with us today through answering our questions. And with that, we're going to wrap up today's episode.
Great. Thanks so much. Happy to be here. Take care.
Yeah.